Video presentation by Department of Panchakarma, Sindagi Shantvireshwara Ayurvedic Medical College and Hospital, Haveri. This video is about Mukhadushika and Panchakarma. Introduction. Mukhadushika is common facial skin disorder in Ayurveda. Explanation. Due to the obstruction of srotas in face, pimples are formed. This disease is also referred to as Tilakalpa as it resembles sesame-like eruptions on skin. Mukhadushika, facial blemishes. Dushika, that which vitiates. Derived from Sanskrit roots indicating impurity on the face. The term Dushika is derived from the root dush, meaning to spoil or corrupt, indicating its vitiating nature. Mukhadushika resembles Tilaka in size. Explanation. Caused by vitiation of Raktamokshana kapha, these lesions resembles sesame seeds, are reddish, painful and has discharge. Caused by improper diet and lifestyle, induces heavy oily food and improper habits. Stress, emotional disturbance are recognized as manasika nidanas. Hormonal imbalance during adolescence is considered a contributing factor. Pathogenesis. Dosha, mainly Pitta and Kapha. Dusha, Rakta Meda Tok. Srotas, Rasava and Raktava. Imbalanced Pitta and Kapha block the skin channels, leading to the buildup of the impurities and formation of the pimples. Blockage of the srotas, especially due to the kapha and the meda, leads to local accumulation and formation of the acne lesions. Samprapti Ghataka. Dosha, Pitta and Kapha. Dusha, Rakta and Meda. Adhisthana face. Meda plays a key role in lesion formation due to its association with kapha. Mukha is the most common affected region due to its sensitivity and exposure. Pimple-like, painful, sometimes discharging. Lesions appear small, raised bump often filled with pus. Common symptoms include itching, burning sensation and pain on touch. Lesions may increase before menstruation or during stress. Scarring and dark spots may remain after healing if untreated. Types. Pittaja, Kaphaja, Raktaja based on dosha predominance. Pittaja, inflammatory, hot, red. Kaphaja, cold. Raktaja, deep-rooted, blue, red, painful. Diagnosis. Based on Darshana Sparshana Prashna. Darshana Pariksha. Visual examination of lesions. Yuvanapidika appears as raised eruptions with pus or inflammation. Sparshana Pariksha. On palpation, pain, hardness or tenderness may be felt. Prashna Pariksha. Detailed history taking age, diet, lifestyle, menstrual history in females and stress level are monitored. Management of Mukhadushika. Shodhana, Shamana, Chikitsa. Patya consideration. Shodhana Chikitsa. Virechana to eliminate Pitta and Kapha. Raktamokshana for local blood vitiation and relief. Shamana Chikitsa. Use of herbs with Tikta, Kashaya tastes and Rasayana properties. Internal drugs. Nimba, Haridra, Khadira, Manjista, Triphala, etc. Raktamokshana, Purvakarma, Rogi Pariksha. Assessing dosha, dusha, rogibala, rogabala, sthana nirnaya, usually facial region or back in Mukhadushika. Abhyantara Shodhana, mild sneha and virechana, sthanika sneha and sweda at the site of bloodletting. Selection of the method, Siraveda for generalized or severe vitiation, Jalokacharna for localized inflamed lesions. Pradhana Karma, Jalokacharna, most used in Mukhadushika. Leech applied over inflamed pimple region. Let it suck blood until it detaches or 15 to 30 minutes. Remove carefully and apply Haridra Churna at site. B. Siraveda if indicated. Vein section, tourniquet application. Vein punctured under sterile condition. Remove required amount of blood. Observe the blood control. Vega nivrutti. Stop after desired amount. Panchakarma, clean area with sterile gauze. Apply lepa like Haridra plus ghee or Nimbapatra Kalka. Rest of the light food for a day. Avoid Divasapna, Vyayama, Ruksha Sevana, Ati Sevana of hot substances. Lepa, Purvakarma. Mukha Prakshalana with Trifalakwata or Nimbak Kashaya. Skin should be clean, dry and non-irritated. Select appropriate Lepa Dravya as per dosha predominance. Pitta Rakta, Manjista Haridra, Lodra, Kapha, Vacha Musta Trifala. Lepa, Pradhan Karma and Panchakarma. Prepared Kalka using fine powders plus suitable liquid media. Tarka, Nimba, Swarasa, Godugda, Arkajala based on Prakriti. Apply a thin layer on affected region without rubbing leaves for 15 to 30 minutes or until semi-dry. Remove gently using soft cloth soaked in lukewarm water. Panchakarma, wash gently with lukewarm water. Apply light oil if dryness occurs. Avoid direct sun, direct exposure and makeup for few hours. Repeated daily or alternative day as needed. Other treatments: Prachana Karma, bloodletting by scraping or cutting. Definition: Prachana is the method of Raktamokshana where multiple small superficial incisions are made over the affected area using the sterile sharp instrument to allow vitiated blood to ooze out. Svedana helps open up srotas, reduce stiffness and localized doshas. Patrapinda Sveda or Nadi Sveda on affected areas. Use leaves of Nimba Iranda Rasna. Abhyanga Snehapana Nasya. Shamana Chikitsa, use of herbal drugs, Manjista, Nimba, Haridra, Nimbadi Gugulu, indicated in Kushta Pidaka Raktapitta Dushti, Kaishora Gugulu, Raktashodhaka, reduces inflammation and acne, Gandhaka Rasayana, antimicrobial Rasayana, enhances skin health, Manjista Dikwata, blood purifier, pacifies Pitta and Rakta. Bahya Chikitsa, Lepa, Dhavanam, Udavarta with Ayurvedic herbs. Ahara Vihara, avoid oily, spicy food, adopt bitter astringent diet, sufficient sleep or early sleeping routine, Laghu Shita Virya Dravya, Tikta Kashaya Rasa Pradhana Ahara. Yoga एवं प्राकृतिक चिकित्सा, जलनेति, प्राणायाम, herbal packs, dinacharya to maintain skin health. Preventive steps: avoid synthetic cosmetics, maintain digestion, sleep hygiene, regular dinacharya, daily routine, gentle facial cleansing with Triphala Kwata, application of Kumara Lepa or Nimba Taila, Anutaila Nase in morning if kapha prone. Modern correlation: acne vulgaris. Definition: acne vulgaris is a common chronic skin disorder of pilosebaceous unit characterized by comedians, papules, pustules, nodules and sometimes scarring. Etiology: hormonal changes, increased sebum production, follicular hyperkeratinization, Cutibacterium acne, proliferation and inflammation. Investigation: hormonal evaluation, PCOS in female, blood glucose lipid profile, bacterial culture, modern treatment approach, topical therapy for mild to moderate acne, retinoids, benzoyl peroxide, topical antibiotics like clindamycin and erythromycin. Conclusion: Ayurveda treats Mukhadooshika holistically. Shodhana, Shamana, Ahara, Vihara are important pillars. Proper observance of Patya Apatya, seasonal regimen and Rasayana Prayoga enhances long-term control and recurrence prevention. Thus, Mukhadooshika can be effectively managed through Ayurvedic Samagra Chikitsa, which not only alleviates symptoms but purifies and rejuvenates Sharira and Manas.